Do you see or understand why some people may think what you're doing is controversial with these patients?
This isn't about judgment. This isn't one person. It's not me, just deciding who lives or who dies or something like that. We've been really thoughtful about this. The analogy I like to use is if you have someone who was drinking and they were crossing the street and they crossed the street at the wrong time and they got hit and it wasn't the driver's fault and they came to a trauma center like our trauma center, they wouldn't say, oh, we're not going to treat you. You might die because you were drinking tonight and you caused this accident yourself. We're doctors, we're nurses, we're trying to save people's lives.
So they could be drinking, say 2 days ago, and in theory, under this program, they could then get a transplant right after that.
It's not a cut and dry thing. If it was really easy, I'd be able to just decide who gets a liver transplant. But everyone who's listed at our hospital and is listed anywhere in America goes through an evaluation period with a multidisciplinary team, and we have a committee meeting where we talk about the patient and their suitability for transplant. And the things that we're looking for are they gonna stop the behaviors that cause them to lose their liver in the first place? I mean, that's probably the primary thing. And are they able to take care of that organ? And if you can answer those two questions, yes, then there's not a lot of conditions, I guess, I would make on when someone was drinking, not drinking. Transplant's about, radical change. And it's about asking, why aren't we doing this? And people don't ask that question, then we'll just do the same things we did 35 years ago or 40 years ago. And that's not a profession that I'm super interested in. So for me, this is, I advocate for it. I'm interested in it because generally these are young people who've made, some poor choices. They have a disease, it's called alcoholism, and, that shouldn't define their whole lives, and people conquer that disease all the time.
So you believe that addiction is in fact a disease?
That's really the crux of our issue here, right? I don't think there's any doubt that it's a disease, and it's like a curable disease on top of it. The cure kind of takes your whole life, and it never goes away. It's a chronic disease, but we have these really excellent addiction medicine folks here at ECU. We have a nurse who's really dedicated to these patients, and that kind of focus is what you need to be successful. We have an organized program. It's not put together with rubber bands and chewing gum. We have a addiction medicine group here called the Motivate Clinic that is the best I've ever seen. It's run by really wonderfully trained psychiatrists, and it's really one of a kind.
What do you want someone to know that still may be on the fence about the program?
It's really a very easy thing to judge people. It's super easy to say no, yes, no, yes. You gotta really think about that, because there's nothing that you could do to help someone if they're dead. They're out of your reach. So if you're gonna make that decision and you're gonna say that, no, this person shouldn't get a liver, they were drinking, and they're gone. I'm telling you that we're doing this, and they're taking good care of these organs, and they're living a productive life afterwards.